Example dictation using the cardiology clinic template using standard mode. Patient is John Doe, a 70-year-old male, date of birth March 4, 1954, medical record number 123456778. Mr. Doe is seen today for progressive shortness of breath over the past 3 weeks. Symptoms are worse with exertion, associated with mild chest tightness, and relieved partially by rest. No orthopnea, paroxysmal nocturnal dyspnea, or lower extremity edema reported. Past medical history: coronary artery disease status post-drug-eluting stents to the LAD and RCA in 2019, paroxysmal atrial fibrillation, hypertension, type 2 diabetes mellitus, and hyperlipidemia. Past surgical history: percutaneous coronary intervention with stent placement in May 2019, laparoscopic cholecystectomy in 2012, and right inguinal hernia repair in 2005. He is on aspirin 81 mg daily, clopidogrel 75 mg daily, apixaban 5 mg twice daily, metoprolol succinate 50 mg daily, lisinopril 10 mg daily, atorvastatin 80 mg nightly, and metformin 1000 mg twice daily. Today's EKG shows normal sinus rhythm with occasional premature atrial complexes and prior inferior Q waves unchanged. Recent echocardiogram demonstrates left ventricular ejection fraction of 45% with mild hypokinesis of the anterior wall. He reports exertional calf claudication after 2 blocks of walking, and a recent CT angiogram demonstrated multi-level peripheral arterial disease involving the superficial femoral arteries bilaterally. Lab panel last week revealed LDL 68, HbA1c 6.8, creatinine 1.1. Assessment: coronary artery disease with exertional symptoms concerning for unstable angina, chronic hypertension, diabetes with fair control, peripheral arterial disease evidenced by exertional claudication and CT angiogram findings, and paroxysmal atrial fibrillation currently rate controlled. Plan: Number 1, schedule an urgent stress nuclear perfusion study to evaluate for ischemia. Number 2, increase metoprolol succinate to 75 mg daily and monitor heart rate and blood pressure. Number 3, refer for vascular surgery evaluation and initiate supervised exercise therapy for PAD, continue aspirin, and start cilostazol pending clearance based on CT angiogram findings. Number 4, reinforce daily weight monitoring and low sodium diet, have nursing review heart failure warning signs. Number 5, continue dual antiplatelet therapy, apixaban, and high-intensity statin, reassess in cardiology clinic in 4 weeks or sooner if symptoms escalate. After you are done dictating, hit the microphone button again to stop recording. Your note will be baked and ready for your preview in few seconds. If any calculators are attached with the template or manually added on top of template provided calculators, the score stage will be calculated automatically based on the information provided. Incomplete information may result in an inaccurate score stage. Once you finish dictating a note, the system automatically inserts your saved signature from your profile. Click Edit Note if you want to refine or add some more information before finalizing the documentation. For example, you might dictate, "I forgot to mention the patient had a minor embolic stroke 10 years ago without any residual deficit, with a height of 5 feet 6 inches, and a weight of 260 pounds. The system analyzes those edits, rewrites the note with the specified changes, and refreshes any calculator values automatically. When your note is finalized, click the copy button at the bottom of the preview to place the note on your clipboard and paste it into an EHR. Templates and notes are always within reach from the buttons at the bottom of the home screen. The template gallery includes a share option so you can invite colleagues, assigning edit rights for collaborative updates, or view-only access for read-only sharing. Notes support the same sharing controls, ensuring care teams can update or reference the documentation with the appropriate permissions. Keep in mind that notes are automatically deleted 48 hours after the last modification. Active inpatient or longitudinal notes remain available as long as you or a collaborator makes an update within each 48 hours window. When composing a note, consider adding the patient's room number, or MRN, to the note title. This simple convention makes it far easier to locate the correct documentation if you are planning to use it as daily progress note on inpatient encounters.